The Clinical Anger Scale. Introduction. The CAS provides helpful information in understanding angry clients, the planning of treatment, and the assessment of therapeutic progress. Client scores on the CAS could be compared with non-clinical groups or against CAS norms, once they are established. The CAS may also provide valuable information about clinical status and treatment response. In non-clinical settings, the CAS may prove useful in identifying individuals who have clinical levels of anger or those who are at risk for developing clinical anger. Developer: William E. Snell Jr., Scott Gum, Roger L. Schuck, Joa Mosley, Tamara L. Height.
Purpose: to measure the psychological symptoms presumed to have relevance in the understanding and treatment of clinical anger. To measure the syndrome of clinical anger. To measure the array of psychological, physiological, affective, cognitive and behavioral symptoms constituting clinical anger. Type of assessment: self-report instrument. Indications: individuals who are suffering from major levels of clinical anger, for instance, outpatients and inpatients. Snell et al. 1995. Drug addict. Salim et al. 2013. Depressed patients. Zaidi, 2014.
Administration.
Administration time: approximately 10 minutes.
Administration procedures consists of 21 groups of items with 4 options: A, B, C, D. Subjects were asked to read and identify the statement that best reflects how they felt. Example item 1, A. I do not feel angry. B. I feel angry. C. I am angry most of the time now. D. I am so angry all the time that I can't stand it. Instructions: the group of item below inquire about the types of feelings you have. Each of the 21 groups of items has 4 options. Read and identify the statement that best reflects how you feel. If you choose A, circle the letter A next to the item number associated with that group of statements. Answer the questions even you're not sure. Select only one option from each statement. Please be honest in responding to the statements. Scoring: each cluster of statements was scored on a 4-point Likert scale: A, 0, B, 1, C, 2, D, 3. Subjects' response were summed, range from 0 to 63. Interpretation: 0 to 13, minimal clinical anger, 14 to 19, mild clinical anger, 20 to 28, moderate clinical anger, 29 to 63, severe clinical anger. A higher scores means that the subject has more anger symptoms.
Reliability. Internal consistency. Excellent internal consistency with Krennick alpha coefficients. 0.94 for males and females together. 0.95 for males only. 0.92 for females only. Item 3. Anger about failure had low item total coefficients of 0.13, 0.19, and 0.11, respectively, for the total sample, males only, and females only. Snell et al. 1995. Test reached reliability. The correlations between the 2 administrations of the CAS in 3 weeks interval indicates good test-retest reliability. 0.85 for males only. 0.77 for females only. 0.78 for males and females together. Snell et al. 1995.
Validity, face validity. The initial items were reviewed and discussed not only with professional psychology instructors, but also with a group of undergraduate psychology majors and graduate counseling students. Convergent validity, correlations between CAS and the scores on Spielberger's anger-related instruments are R equals -0.23 to 0.61. CAS was positively correlated with the full range of psychological symptoms measured by the Symptom Checklist 90 revised, R equals 0.39 to 0.68.
Advantages: 1. Less time consuming. 2. Provide information helpful in understanding angry clients, the planning of treatment, and the assessment of therapeutic progress. Snell et al. 1995. 3. Useful in identifying individuals who have clinical levels of anger or those who are at risk for developing clinical anger. Snell et al. 1995. 4. Easily administered in mental health, prison, educational, and other types of settings to screen for anger symptomatology. Snell et al. 1995. Disadvantages: 1. Lack of current research. 2. Content and discriminate validity are not established.
Assalamualaikum. Okay, my name is Nahazwani and I'm an occupational therapist. Okay, today I will do assessment called clinical anger scale. Okay, the purpose of this assessment is to measure syndrome of clinical anger. Okay, basically this assessment consists of 21 items with option A, B, C, D. So you need to read and identify the statement that best reflects how you feel. So if you choose A, then circle the letter A. Answer the question even if you are not sure. Make sure to select only one statement from each of the 21 items. Okay, do you get it? Yes. Okay, and you need to be honest in responding to the statements. The score of this clinical anger scale assessment is 12, which is the patient has minimal clinical anger.